Let's talk about cow poop.
I look in here.
Stay out of my gas hole.
Hey everyone, and welcome to the Cody Creelman Cow Vet podcast. Today we're going to be talking about neonatal diarrhea, or calf scours, one of my favorite topics. If you guys love this podcast, please leave me a review on the iTunes or the podcast app. I would really appreciate you guys subscribe to the podcast and also leave an honest review. Helps in the rankings, and I would appreciate it. If there's anybody who's a listener of the podcast but hasn't checked out any of my videos, I got some really great vlogs up right now. Head to my YouTube page, Cody Creelman Cow Vet. Also give me a subscribe and hit the notification bell and watch video and leave a comment, and I would really appreciate it. You can also find my stuff on Instagram and on the Facebook as well. So right now, today in Cody world, it is it's calving time, and I'm starting to put some calves on fluids, IV fluids, and we'll talk about that, when to make those decisions. So I thought it was a very pertinent time for us to just talk about calf scours in general, because I'm seeing it in practice, and we'll go through it in detail. I was editing some video. I have a really amazing vlog coming up I hope coming up with Emerson and Neve, my kids, out on call last weekend. I filmed what I thought was a very beautiful vlog, and I edited most of it, and my SD card corrupted, and I so far have lost all the footage. But I'm working diligently, so instead of editing video tonight, which takes up the majority of my evening time once everybody in my family goes to bed, I thought I would rock out a little podcast for you guys. So I appreciate the listen. I know the podcast is quite sporadic. It's probably going to be sporadic for a while. My hope is to try to get one out once a week, but sometimes it doesn't happen. So, yeah, that's just what's going on. Okay, let's talk about scours. So, when it comes to calf scours, I think it's really important to just first of all talk about just general calf health first. So, what are everything we can do to set these babies up for success? And the main pillar of setting a calf up for great health is colostrum, right? We want those calves to get circulating levels of antibodies, immunoglobulins in their bloodstream through adequate colostrum management in order for them to be able to fight off all of the pathogens that cause all the different diseases, but in this case, scours, until those calves can start mounting their own immune response to those pathogens innately. So for those of you that don't know, calves are born without an immune system. They get all of their immunity to all the pathogens they're going to see from mom's colostrum, unlike humans, which are born with circulating antibodies. And that just really has to do with how the placenta attaches to the maternal bloodstream and the ability for antibodies to pass through that placental junction. So in cows, it does not pass through very easily, those immunoglobulins. So this species relies very heavily on passive transfer. So this passive transfer of immunoglobulins from mom's colostrum through their gut lining into their circulation, and that's what gives them their immune system right off the bat. So the general rule of thumb in beef calves is to get 2 liters of high quality colostrum within the first 4 hours of life. Now, if a calf is born unassisted, for the most part, they're going to receive adequate levels of colostrum, and they're going to be okay. So for the most part, you just have to watch, make sure baby has sucked within the first 4 hours, and mom has enough of a bag, enough milk, enough colostrum to provide that high quality colostrum to the baby, and we should be good to go. But there is a lot of circumstances that would dictate us to intervene and provide supplemental colostrum. So if you look at the literature, it's pretty interesting. 1/3 of beef calves, at least in this study of calves born in Alberta and Saskatchewan, 1/3 fail to acquire optimal passive immunity. This is a very, very important thing, and this is likely due to delayed colostrum consumption. If these 1/3 of calves do not get adequate colostrum, they have a much higher risk of pre-weaning morbidity, so getting sick, and also pre-weaning mortality. It's a very big risk factor for them to get sick or for them to die. And calves that do not have adequate colostrum consumption, they would also have a pretty significant decrease in their pre-weaning average daily gain, meaning they would have a lower weaning weight. So economically, it is extremely important for those calves to get adequate colostrum by that 4 hours of age. Now, how do you ensure that those calves are going to get enough colostrum? One of the best tools in my mind to do is the suckle reflex test. So this is one of the best ways to assess calf vigor, the ability for that calf to get up and get to nursing through this tool. And it's super simple. So you take a calf that is 10 minutes old, and you put your fingers into its mouth, and you tickle the roof of its mouth. And if you have a strong reflex, that means that those calves are very likely to get enough colostrum. If they have a weak suckle reflex in an unassisted calf, then they have a very high risk of not getting enough colostrum. So a 78% chance in an unassisted calf with a weak suckle reflex for them not to get enough colostrum by 4 hours after birth. So that's with an unassisted calf. Within an assisted calf, so like an easy pull, a calf that has a strong suckle reflex at 10 minutes of age has a 26% chance of not getting enough colostrum. So it's not wonderful. Those easy pulls, there is still a chance, even with a strong suckle reflex, that they're not going to get enough colostrum. Those calves are likely going to be hypoxic, so low oxygen, because of that more difficult birth. That can potentially lead to an acidosis, and that can lead to central nervous system depression. And those calves are also just sore because of that pull. In calves that are an easy pull, that have a weak suckle reflex, they are 94% likely to not get enough colostrum. So very, very, very high chance for them to have failure of passive transfer. When it comes to a difficult pull, if a calf has a strong suckle reflex, it's about 50-50. So 49% of those calves will get enough colostrum if they have a strong suckle reflex, and 98% of them will not get enough colostrum if they have a weak suckle reflex. So as you can see now, the suckle reflex is a very good tool. So overall, if I'm managing a herd and determining whether or not I need to provide supplemental colostrum to a baby calf, I'm going to, for the most part, leave unassisted calves alone unless there's an indication for me to determine their suckle reflex. So calves that are seemingly weak, calves that are born in a cold, calves that are born in a snowbank, calves that just seem off, right? Those kind of dummy looking calves. I'm going to then do the suckle reflex assessment, and if they have a weak suckle reflex, I'm going to give them supplemental colostrum. With an easy pull, I'm going to use the assessment tool every time. I've got the calf in, the mom in, so it's really easy for me at 10 minutes of age to determine what the suckle reflex strength is. And if it is a strong suckle reflex in an easy pull, then I'm going to leave those calves alone, watch them, and they're probably going to get enough colostrum from mom. And if it's a weak suckle reflex, I'm going to provide supplemental colostrum. And when it comes to a hard pull, based on the literature, regardless of if they have a strong suckle reflex or not, I'm just going to go ahead and give them supplemental colostrum. So when I get called out to do a calving, it's typically a hard pull or a C-section, but it's typically a hard pull because I got called out to do it. Then I'm going to recommend supplemental colostrum to those babies. So that's, a good way for us to tell how we're going to assess these baby calves. And once again, remember how important that colostrum is for those calves to get. That those calves that do not have a good amount of colostrum at birth, they are 2.8 times more likely to die than calves that do get enough colostrum. And those calves that have failure of passive transfer, they'll have a decrease in average daily gain of 0.2 pounds per day. So that is very significant when we're talking about overall economics. When it comes to determining, what type of colostrum we should be providing if we're going to do supplemental colostrum, the very best source is that calf's mother, colostrum from your own herd. So those cows in your herd, those are always going to be the best donors because they are exposed to the pathogens that your herd is exposed to, and they're going to have IgG or antibodies that are specific for your environment. It's specific to your individual herd. And mama is always best, right? Mama knows best. If you're going to use a donor cow within your own herd, remember that not all colostrum is created equal. So we want to choose colostrum donors from cows that are in their prime. So typically age 3 to age 7 is when they have the highest concentrations of IgG within their milk as a unit per volume. So heifers don't produce as good a quality of colostrum, and old cows don't produce as good of quality colostrum either. So just because the old 15-year-old swing bag has lots of milk and she's easy to milk out as a donor doesn't necessarily mean that she has the best quality. The other thing to also remember is that heavier milking breeds typically have a more dilute colostrum. So, for example, a Holstein, right? We all know what a Holstein is. They're very high-producing cows in terms of milk, but because their volume is so high, the overall concentration of IgG in their colostrum is actually quite low. Now, those big Holstein calves, they're able to fit more milk into their stomach, so they're able to get away with that, right? Whereas if you try to put just 2 liters of dairy colostrum into a little 60-pound Angus calf, they're not going to get enough. So picking the right donor is very, very important. When we're storing colostrum from our herd, we can store it in the freezer as long as it just goes through one freeze-thaw cycle. So we don't want to freeze it, thaw it, freeze it, thaw it, freeze it, thaw it. Remember those IgG, those antibodies, they're proteins essentially. And if we freeze-thaw proteins too many times, just think of like a steak, right? If you freeze-thaw a steak, you're going to degrade those proteins. So we can freeze it. It's good in a freezer for 1 year. We should just discard it after a year. And And when we are thawing that colostrum, we want to be very gentle with it. So we want it to thaw in just warm water in the sink and gradually increase that temperature. We don't want to put it into the microwave. We don't want to put it in boiling water because that can denature the proteins. Think of the steak analogy again. Letting a steak thaw out on the countertop, the meat quality is quite a bit better. The protein quality is quite a bit better, as opposed to if we run it through the microwave and we have brown spots and it loses more liquid because the proteins have degraded. So that's, one consideration. The commercial colostrum products are also very good. These are from disease-certified free herds. They are vaccinated for a variety of different diseases that we want to have antibodies for, and they do a really good job with packaging them. So in Canada, I would say Saskatoon Colostrum Company is certainly the top of the game when it comes to donor colostrum. There's lots of quality assurance in there, disease-free, and I always feel very confident in using that product. The big no-no is buying dairy colostrum from a neighbor or buying colostrum from beef cows from a neighbor. Like I said, with dairy colostrum, that volume is really high, so the concentration of IgG is quite low. And then there's also the high potential for disease transmission, specifically Johne's disease, a lot more prevalent in our North American dairies than it is in the beef herds. So we can potentially be bringing organisms onto farm that can cause a big problem in the future. If the calf is quite small, we can split those feedings over a couple of times. But remember, for every hour we go over that 4-hour window, we're losing the ability for that calf to absorb those IgGs, those antibodies. So as the calf ages, the ability for it to efficiently absorb those molecules in the gut decreases. So, for example, you would have a high rate of absorption in hours 1 through 4, and after hour 4, the gut starts to close down, and those immunoglobulins do not transfer as effectively through. They're still open to a small extent by 24 hours, but they have significantly closed in comparison to hour 4, and it is a lot harder for us to pass those antibodies through that gut wall. But you can split feed if necessary, if it's a small calf. Once again, like the 50-pound Angus calf, certainly you might have to do 2 1-liter feedings within the first 4 hours, and that's okay. And then back to the colostrum products. Regardless of the brand that you use, one of the most important things to look for is on the bag, it'll say how many grams of IgG are available in that bag. So a total colostrum replacement in a commercial product has 100 grams of IgG. So make sure you see that. That means that one bag should be adequate in most cases in order for us to provide a high level of IgG to those calves. But there is also supplement products on the market as well. Those typically have between 50 and 60 grams of IgG. So where those come in well is if the calf sucks some, but not enough, or the cow didn't have enough and you milked her out. You could get a liter out of her. It's good to give that to the baby, but then you're also going to have to provide a supplement product. So just be careful when you're purchasing those bags. Make sure you see this 100 grams of IgG or 50 grams of IgG and know what you're getting, a supplement versus a replacement. I have seen some lesser quality products on the market, specifically in the US, and they try to trick you with that 100-gram number, and it'll say colostrum replacer, 100 grams of colostrum provided. So, and the rest is just filler. So they know that producers are looking for that 100-gram mark, and they're saying 100 grams of bovine colostrum, and that's not what we need. We need 100 grams of IgG certified in order for us to get enough colostrum into those babies. That said, there certainly is literature out there showing that 100 grams is the absolute bare minimum, and there is some benefit to feeding even more, up to 150 grams, 200 grams of IgG. I'm not advocating that calves need to get 2 bags of complete colostrum replacer, but just keep in mind in terms of what the literature says that there is that those calves could benefit from more colostrum as opposed to less. So now that we've talked about colostrum, let's talk about scours. So scours is just a lay term for neonatal diarrhea, and there's a variety of different pathogens that can cause neonatal diarrhea in baby calves. So we have the viruses, coronavirus and rotavirus. They typically will take hold somewhere between the first week of life, so about the first 5 days, all the way out to 3 to 4 weeks of age, depending on the virus. So that's kind of the risk window. BVD is also a virus that can be a Scours pathogen, but typically we don't see that in calves manifesting until they're a little bit older, 5 weeks or older. So those are the viral components, and then there's bacterial pathogens that can cause diarrhea as well. So we have E. coli. Typically, E. coli will affect baby calves earlier in their life, so within the first week, right from pretty much day 0, day 1, out to that first week. And then we also, in terms of the bacteria that can cause scours, salmonella is another significant pathogen. Usually that doesn't hit calves until about day 10, and then you can see that right through calfhood. Clostridial perfringens, that is also another bacterial pathogen that can cause scours. Usually we'll see that from day 5 all the way out to greater than week 5. And then we have our protozoa. So we have the viruses, we have the bacterial causes, and we also have a protozoal cause. So coccidiosis, coccidia, miria, they are little protozoa that can cause very significant diarrhea. We don't see that often until day 21, but there is some species of Amiria of the protozoa that can mature within 12 days, the earliest maturing ones. So you can see coccidiosis a little bit earlier, depending on the species that you're working with, but typically 21 days and greater is the magic number. And then the last protozoa of note is Cryptosporidium. So crypto is a protozoa that can affect those calves fairly early on within the first week of life, and can affect those calves, usually anywhere out through week 2, 3, and 4. Crypto is the famous one in vet school, or when we have vet students out on rotation and they're dealing with calves that have scours. If your vet student disappears like 2 days later after you hook a calf on fluids, you're usually pretty confident that they came down with crypto. It's a pretty infectious disease. It only takes a few of those protozoa to cause a clinical infection, and you'll get the human scours pretty good for a few days. Great weight loss program. That's a great point with a lot of these pathogens is they can be zoonotic. Not all of them, but some of them are zoonotic, meaning that people can certainly get them. So we do have to use strict biosecurity. We have to make sure we're washing our hands, that we're wearing gloves, especially when we're dealing with or potentially contaminating people that are immunocompromised. So the elderly, the very young, people on chemo, the chronically ill type people. They're more susceptible to contracting pathogens in general, so we have to be very diligent in terms of our biosecurity. So E. coli can be zoonotic, salmonella can be zoonotic, crypto can be zoonotic, so we have to exercise extreme caution when we're dealing with scouring calves. So like all diseases, it certainly is multifactorial. There's a number of risk factors and that can be causative. And there's also often multiple pathogens involved. We don't often see just a single Scours pathogen causing all the trouble. A lot of times we'll see a combination, so viral and crypto and so on. So just remember that it is a very complex disease process involving the pathogen, so how virulent the pathogen is, what type of pathogen we're dealing with. The calf, we're worried about host immunity, their ability to mount a proper immune response, how much colostrum did they get, and then also the environmental factors. So where are we calving? Our calves out? What is our pair out strategy? What is our overall biosecurity strategy, our management strategy for preventing scours in general? And we'll talk a little bit more about that. But, we really want to focus on improving management. We really want to focus on minimizing exposure. And through that, hopefully we are preventing clinical disease. So things like Scours vaccinations, they can help in some circumstances. And I certainly have clients that use them and have had great success with using Scours vaccinations. But in general, Scours is a disease of management. So if we can make some management changes, often we can mitigate our overall Scours risk within our herd. There's a lot of things that we can do for preventing scours, even pre-calving. So ensuring that cows are in an adequate body condition score. In Canada, we use a 5-point scale. So having cows in that 3 to 3.5 out of 5 range, fleshy, adequate nutrition cows, can go a long ways in terms of preventing scours. Also making sure that those cows, have adequate minerals and vitamins can really help. Also with making sure that we have healthy cows and thus good quality colostrum. Like I noted before, pre-calving, we can use vaccines to help. Those vaccines are given pre-calving, and what they're doing is they're boosting that immunoglobulin, that IgG in the colostrum, and that's how they work, is through vaccinating the cow. We have a better array of exposure to these pathogens in vaccine form, and that cow will mount an immune response against those pathogens in the vaccine, and she will dump those immunoglobulins into her colostrum pre-calving. So it is a supplement in terms of scour control, but management is always best. And when we're talking about environment and pre-calving scour prevention strategies, calving in favorable weather certainly can help. It allows us to reduce the need to confine those animals or intensively management, and cold and wet conditions can certainly lend to stress and impaired immunity. So if I just got to pick the best calving strategy for the mitigation of scours, that would be calving in May and June out on green grass, where we can really spread out the risk of that pathogen contamination. Calving out on grass definitely is one of the best management things that we can do, but certainly it's not an option in a lot of different herds for a lot of different reasons. So we just have to learn to work around that. Prior to calving, if at all possible, it's important to not overwinter cattle on calving pastures. So think about cows getting put in their dry lots or put onto their feeding grounds, being fed there all winter, shedding all kinds of pathogens, and then we start calving in that area as well. That certainly can lead to a higher risk of those calves coming across certain pathogens and getting infected. We can also do some pre-calving preventions with calving our heifers out early and separate from the cows. Heifers in general shed more pathogens versus cows, so they are super shedders. And calves born to heifers typically have poor immunity as well. So if we can get those ones calved out first, those calves to heifers calved out first, when the overall pathogen burden is quite low, we can mitigate some Scours issues as opposed to calving everybody at the same time. And if we're able to, through management, it's also a great idea to try not to overcrowd your animals, and there's some strategies we can do for that. So one approach would be to actually make sure that we're preg testing and staging, and then we can sort off the late calvers, because we know we don't need to be watching them as closely and put them in a different pasture altogether. So it just decreases the overall stocking density of our calving grounds. And we can also, from there, start thinking about some strategic pasture management tools, essentially minimizing commingling between the age groups and limiting contamination. So I'll try to, describe some typical calving pasture management scenarios that we see. So one would be, especially when we need a barn because we're calving in colder weather, we would have our calving pasture and our barn close to that. And as calves are born, then we're putting them into a nurse pen. So we're pairing them out to a nurse pen. And then we have our turnout pasture. So calves are born in that calving pasture. They get put onto the nurse pen, make sure that those calves are pairing up, and then we're put out into that turnout pasture. So everything's going good from that regard. Usually for the first 3 weeks, we don't see much in terms of Scours. But then all of a sudden we'll see some Scours break in that nurse pen. And if we keep pairing out into that nurse pen, we're going to be exposing those new babies to a lot of pathogens in the nurse pen. And before we know it, we're going to see Scours also in our turnout pasture. So it is very, very important when you're designing your calving pasture systems to recognize that once calves are about 3 weeks of age or older, they're pretty much past the high level of risk for getting Scours. So they have a really high risk earlier on when they're really, really young, and then after that they develop a bit better immune system. So the risk of Scours also really isn't that high until we get into 3 or 4 weeks into calving season, and that's when the risk of those calves getting sick is a lot higher. So when we're thinking about that calves typically don't get sick within the first 3 weeks of calving season because there isn't a high pathogen load, and then calves older than 3 weeks are less susceptible to getting infected, we can start implementing some different strategies to segregate calves by age to minimize direct and indirect transmission of those pathogens from older to younger calves. So in an ideal situation, what we would want is to calve cows out in a pasture, and then after about 2 to 3 weeks, everybody that hasn't calved yet gets moved to a new pasture, a new fresh pasture. We calve those out for 2 or 3 weeks, and then the ones that haven't calved get moved to a new pasture, and then we calve them out for 2 or 3 weeks, and then the ones that haven't calved get moved to a new pasture. So those ones are getting, everybody's always calving on a fresh pasture for the first 2 or 3 weeks, and that is very representative of what's called the Sandhills calving management system. So just really taking into account those parameters of when calves are at a higher risk. Once they're in that that 4 to 6 week age group, that's when we can start moving and managing those groups together again as a whole. So we don't have to manage them in 4 separate pens for the rest of the winter, the rest of the calving season. Once they get old enough, then we can turn them all back together again. Once those younger calves aren't as young anymore, and we can manage them as a group again. So that's the Sandhills. The benefits of the Sandhills calving system is that calves 2 weeks of age are separated from the newborns. All the cows calve on clean grounds, and it's easier to move cows versus pairs. So we're moving just the cows that haven't calved yet onto new pastures as opposed to pairing out. So that can be good. The cons to the Sandhills calving system is that it is certainly difficult to keep all the cows near the barn when we're using or utilizing a barn in some of the colder weather. And overall, the Sandhills calving system is pretty difficult when we're dealing with large numbers. Now, knowing all those different things, there is, if that's not the right route for you, there is a lot of things we can do to use kind of like a modified Sandhills calving system with the same principles. So we can be calving out at a main barn and have multiple pair-out pastures. So everybody calves out in the same place, but as soon as they calve, they get paired out into pasture number 1, and they get moved onto that pasture for the first 2 weeks, and then we close that down, and then the next wave of calves to be born get born near the barn, and then we pair them out into a new pair-out pasture. Then after 2 to 3 weeks, we shut that down, and then we go to the next one and the next one. And that's a little trickier because we're moving pairs as opposed to moving individual cows. But that said, there's a lot of different things that we can do. So when we're consulting in our practice, one thing that we'll do is we'll just pull Google image data of an individual farm, and we look to see what we have to work with. So we look at all the different calving facilities, we look at all the pens, and it gives us a really great visual interpretation of how can we best create a system of flow in terms of calving management that will mitigate overall disease transmission and hopefully scours. So yeah, there's a lot of creative ways that we can get around that. It is not easy, but with a little bit of planning, it can go certainly a very, very long way. When it comes to treating, so let's say we've done everything that we possibly can in terms of pre-calving, prevention. When it comes to treating, it's very important to remember what type of pathogens cause scours, because the majority of those pathogens are not bacteria, and bacteria are the only ones that respond to antibiotics. So I think there's a lot of antibiotic usage in scouring cases that don't need to be used because viruses don't respond to antibiotics, and protozoa don't respond to typical antibiotics. So we can limit a lot of the antibiotic usage and really focus on oral rehydration therapy. Calf boluses that have, like say, a sulfamethazine in it or a neomycin, different antibiotics, are really only good in very select cases where we have confirmed bacterial causing scours. And when we're just using those boluses indiscriminately for treating scours, we're probably conferring resistance, both in our own herd and then also across the entire industry. So the absolute pillar of treating calf scours is oral rehydration therapy. So giving electrolytes. The amount to give electrolytes, I like to go through just to teach producers a bit about what the overall deficit of fluids there is in a typical calf based off of some clinical signs. So we'll talk about percent dehydration. So let's say today you drank enough water all day long, you're 0% dehydrated, okay? Let's say you drank half a case of Bud Light last night and you woke up in the morning and you're feeling a little down. You're probably like 2% dehydrated, okay? So as soon as a calf starts squirting with diarrhea and is still bright and alert, still heads up, still running, still playing, still nursing, but is full squirting, they're probably close to that 2% dehydration rate. As that goes further and further down, essentially the maximum is 14%. So 0% dehydrated, that's just us normally, and 14% dehydrated or greater equals death. And then we have the spectrum between the 0 and 14%. And we can judge that based off of the clinical signs of those calves. So between 0 and 4%, we're going to have mildly depressed calves. And if you're watching closely, you're also going to have a decreased urine output as well. So squirting and starting to get a little bit depressed, that 0 to 4%. Between 4 and 8%, what we are going to see is sunken eyes. We're going to see a pretty dry mouth and nose. We're also going to start to see some staggering, some skin tent. Those calves are getting close to needing IV therapy, but they're still standing, okay? So that's kind of our metric. They're looking dehydrated, but they're still able to walk around depressed. Those calves we can treat with oral rehydration therapy, with oral electrolytes. As soon as those calves go down, both just recumbent on their chest, so unable to stand, but still heads up, or if they're flat out, those calves are going to be between 8% and 14% dehydrated. Those ones need intravenous therapy. They need to have a vet treat them using either a combination of hypertonic bicarb solution and then relying on oral rehydration therapy from there, or putting them on bags of fluids like some of you guys might have seen, like an isotonic saline solution or an LRS solution to get those calves back and rehydrated. So the reason that I talk about percentages is that also equates roughly to how much fluids a calf needs. So if a calf is 1% dehydrated, it needs an extra 1 liter of fluids in terms of oral rehydration. If it's 2%, we need 2 liters. If it's 4%, we need 4 liters throughout the day. If it's 8%, we need 8 liters per day. So that's why we talk about the percentage of dehydration as it relates to clinical signs. And then that allows us to accurately identify how much fluids is needed for our baby calves to go back to normal. It is really difficult, let's say at 6 to 8%, to get enough fluids into them through oral rehydration. So most of those oral rehydration bags or powders or whatever you use are going to mix with 2 liters of water. So 2 liters tube fed or bottle fed to those calves. That's pretty easy to do. 4 liters, not too bad. Tube that calf twice or offered an electrolyte bottle twice. 3 times a day is a big ask. That's a lot of work. 4 times a day, that's a lot of work as well. But just so you guys know, that's kind of the range. And to reiterate, once a calf is down on sternal, so recumbent in sternal, or is flat out, those ones need vet attention. Now, the clinical signs aren't necessarily related to pure dehydration. A lot of the clinical signs that we see are related to acidosis, so a buildup of acid in the bloodstream, and through correcting that using hypertonic bicarb, using buffered solutions like LRS, that will buffer the acid and make those calves feel better. So that's a lot of what we're doing. The oral electrolytes also have a buffering agent in them. So we're not only just correcting the dehydration, which is important, but even more importantly, we're correcting the acid buildup, this acidosis. So very important to remember there that's how we're approaching it. That's why we're using those specific products, is to combat the acidosis and not necessarily the dehydration. One question that I often get is, do I cut out milk feedings completely? And the answer is no. Those calves still need calories. They need calories to live. They need calories to heal. So combine or alternate electrolyte feedings with milk feedings. So if a calf is 4% dehydrated and you need to give it 4 liters over the day, do a 2-liter feeding of the electrolytes, and then a 2-liter feeding of milk, and then a 2-liter feeding of electrolytes again, and a 2-liter feeding of milk. And that will help keep those calves' energy levels up. So oral rehydration therapy is paramount in how we treat those calves. There's also some add-ons or adjunct therapy that can be added when we're talking about treating calves with scours. One product that some of our producers use is a smectite clay product called Platinum GI. What else is that called? I think in the States it might be called Biosponge. Essentially, this is a special clay that you can add 3 tablespoons to the oral electrolyte solution, and it helps bung those calves a little bit up, so retain water. And there's also some literature on the human side and on the equine side that it binds toxins as well, so enterotoxins from some of those bacteria is a nice adjunct therapy when we have it. And then also administration of a non-steroidal anti-inflammatory, meloxicam being the most common one. Once those calves are hydrated, we can give them non-steroidal anti-inflammatory. What that's going to do is have an anti-inflammatory effect in the gut. We decrease the inflammation in the gut, and hopefully we decrease some of the water losses and make those calves feel better. Now, you'll note that I have not said anything about antibiotics in treating calf scours. But there are some cases when we do need to go with antibiotics. So the logical first case is when we have a diagnosis of a bacterial scours in a herd done by lab work. So when we go out and take a fecal sample of a calf that's broke with diarrhea, and then we send that off to a lab and we get a definitive result back, and we get a susceptibility pattern based off of which antimicrobials those calves, those pathogens will be susceptible to, then we can at that point go ahead and give an antibiotic as per vet recommendation. The other time in scour cases when we're also going to potentially reach for antibiotics is if those calves you've done everything else right and those calves are still running a fever. That can be an indication that there's a bacterial component as well, bacterial septicemia, and at that point it would be then prudent to consider moving an antibiotic into the treatment protocol if those calves are more depressed than they should be or febrile with a temperature. When we're talking about protozoal, so if we see coccidiosis or even potentially crypto, one product that can be used is tazarol. So this is the active ingredient in the brand name product Baycox, just for reference. Here in Alberta, there's several compounding pharmacies that will make a compounded toltazarol product, and that is an anti-coccidiosis drug, a single-dose oral therapy for the treatment of coccidiosis. And then there's also some supportive literature, or I'd say some mildly supportive literature out there that toltazerol, especially in combination with the antibiotic called azithromycin. So toltazerol could potentially have a cryptosporidium treatment effect. So an anti-cryptosporidium drug. Now, this isn't on the label. This is not supported to the fullest extent in the literature. But there is some in-lab data along with some clinical trials in combination with azithromycin, like I said, that it could be effective in an outbreak situation of cryptosporidium. When we've treated, or we're in the midst of treating, I just want to reiterate how important hygiene is, from passing those pathogens to humans, but also different calves. An example would be the esophageal feeder bag or the tube, or the bottle and nipple that we're using to feed these electrolytes to. We want to have a separate set altogether for sick calves, and we want to have a separate set of bottles and tubes for giving that to healthy calves. You can imagine the worst thing in the world you could do is go out there tubing calves all day with electrolytes in the midst of a Scours outbreak, and then you take that dirty old tube, fill it with colostrum, and shove it down the next calf's throat that just needed supplemental colostrum. You're going to inoculate them with whatever virus, bacteria, or protozoa that you're fighting against, and it's going to be an uphill battle from there for sure. Is that everything I know about Scours? I think it might be. Okay, guys, if you have any questions about Scours, prevention, or potentially treatment, or the pathogenesis, just reach out to me. My email is cody@codycreelman.com, or you can slide into my DMs on the Instagram or send me a Facebook message on my Cody Creelman Calvet Facebook page, and I will absolutely love to talk to you guys, and we can talk all about the poops. So I appreciate you guys listening, and I look forward to the next podcast. I don't know when it's going to be. Hopefully soon. I want to talk about pneumonia in calves, pre-branding and post-branding, and also branding time, vaccination, branding time, anti-inflammatory usage, implant strategies, fly control, and the gambit of branding time, because that's coming up very fast as well. So I think that'll be the next one. Okay, that's it. See ya.